Hi, hello everyone. Now we are discussing one important exercise in FMT practicals, that is medico-legal report on an alleged victim or survivor of sexual assault. So it carried 10 mark in your exam. So what are the components of the certificates? So there are 10 components. The first one, general particulars. You need to write all the general particulars related to the case. Second, informed consent or informed refusal. Third, identification mark, presenting complaints. What are the presenting complaints? Pain or bleeding, history, examination, then investigation and treatment, collection and preservation of sample. So that is FSL, forensic science laboratory samples, provisional opinion, lastly the final opinion. So I am discussing only the practical aspects of this certificate. For theoretical aspects like what is rape, define rape, what are the components of definition of rape, what is the punishment for rape, all this you can go through the theory classes. So all these are the components. There are 10 components. Each carry around zero point 0.5 to 1 mark. So like example here is the checklist given from NMC. So criminal details zero point 0.5, consent 1. So your investigation, so that carry zero point 0.5, and opinion 2, date and time of completion of examination zero point 0.5, sample collection 1 mark, sample collection investigation, clinical laboratory, that is 1 mark, local examination 1 mark, like that. So checklist you must know. So total mark is around 10 mark. So what is the first general particular? So you need to mention all the general particular in certificate. Like here we can see here, name of the hospital, OPD number or inpatient number. The name of the hospital you can write, so the hospital name, example Maulana Azad Medical College or LNGP Hospital. Name, daughter or son of. Sometimes the victim can be male also. Address, age as reported. A question can be asked in your exam. What is the consenting age for medical legal examination of victim of rape? Your answer should be 12 years. 12. Then date and time of arrival in the hospital, date and time of commencement of examination, brought by the name and the signature of the person, MLC number. What is MLC? MLC means medical legal case. So definitely, so this is a medical legal case. So the question can be asked, what are the examples for other medical legal case? Answer should be, that is road traffic accident, like example injury certificate and others. So whether conscious, oriented to time, place and person, that you can write yes or no. Any physical, intellectual, psycho, social disability, all these general particulars you need to make. Sometimes the question can be asked, rape is defined under. So rape is defined under section 63 of BNS, that is Bharatiya Nyaya Samvitha. So previously it was defined under section 375 of IPC and punished under, that is 376. So 64 of BNS, Bharatiya Nyaya Samhita, that defines the punishment. So all these are the updates that you must know that can be asked in your upcoming exam. So and also here the question can be asked, disclosure of identity of victim of rape. So it is punishable under 228 IPC. Now it is punishable under 72 BNS, Bharatiya Nyaya Samhita. Printing or publishing of any matter relating to court proceeding without the permission, that is punishable under 73 BNS. So all this can be asked in your waiver. So this is the examination room. The second component, informed consent or informed. What is the consenting age? 12 years. Informed consent. What do you mean by informed consent? Consent can be written consent or oral consent. So, or it can be informed consent. So what is informed consent? This is how you should take informed consent in your examination of victim of rape. So I, that is daughter of or wife of, hereby gives my consent mark. The medical examination for treatment, medical examination, sample collection for clinical and forensic examination. So we need to write yes or no. Remember, so it is mandatory. The consent from the victim is mandatory before doing any examination or investigation in a case of victim of rape. So, and also you need to mention all these words. I also understand that as per law, hospital is required to inform police. This has been explained to me. I want the information to be revealed to the police. This is how you should write the lines. Also, you should write these lines are very important. I have understood the purpose and the procedure of examination, including risk and benefit, explained to me by the examining doctor, usually the female doctor, or in emergency, so sometime, so male doctor in presence of female attendant, in only in the emergency. My right to refuse the examination at any stage, the consequence of such refusal, including my medical treatment, will not be affected by my refusal, has also been explained. It is recorded. The contents of the above have been explained to me in dashed language, so in Hindi language or Kannada language or Tamil language, with the help of social educator or interpreter or support person. Need to circle as appropriate. When I do need to take the signature name of the educator, and also you need to take the name and signature of the survivor also. So, or else you need to take the signature and from the guardian when age of the child is less than 12 years. So, with the date, time, and place, name, signature, thumb impression of the witness on. So, this is important component of your examination. Informed consent is important. And when they are not giving consent for examination or medical legal examination, that you need to document it and you need to take the signature from the survivor or from the guardian when the age is less than 12 years. So this is important component. Taking consent is one of the important component of victim examination. Then identification mark, as we discussed in wound certificate and other certificate. So one or two identification mark. These two identification mark, mole or scar mark, a birthmark. You can see the mole here. Okay. Then presenting complaints. So what are the presenting complaints in case of victim of rape? So usually there can be pain, the pain genital region, or abdomen, or the breast, generalized body pain, or pain while walking, bleeding from vagina, anus, or the mouth. Okay, so all these are the presenting complaint. Need to mention what complaint. So there can be multiple abrasions, multiple bruises, and can be laceration also. Then is the very important component, the history. The history, that is the important component of the certificate. So what is the history? The history about the sexual violence, like date and time of location of incident, number of accused persons, so name, sex, approximate age, any relationship with the survivor. Okay. Then description of incident in the words of narrator, survivor or informant, and type of physical violence, if it is any physical violence, and any emotional abuse or violence like threatening or luring by giving sweets, chocolates, money or job, drug or alcohol intoxication, example, date rape drugs. So, and one more, if survivor has left any marks of injury on assailant. So that is also one of the useful component in the accused. So this is about the history. Then details regarding the sexual violence. So you can write yes or no or don't know against each item. Whether there is a penetration by penis, fingers, object, any other body parts into vagina, urethra, anus or no. As you know, a definition of rape consists of four keywords. What are the four keywords? Schema is the keyword. P for penetration, I for insertion, for manipulation, A for application. So four components: ejaculation into body orifices or any other part, oral sex by assailant and survivor, any post masturbation by self or assailant. You can write yes or no. So the certificate. So and use of condom, a lubricant or object that is used. Post incidents, as survivor change the clothes, undergarments, clean clothes, undergarments, bad. All these details you need to write. Fast urine stool, rinsing mouth, brushing, vomiting. Time since incident, any vaginal bleeding, oral bleeding, so after the incident, any painful urination, painful defecation, seizures, abdominal pain, pain in the genitals, all these are related to the details regarding sexual violence or the incident. Next, so here the question can be asked, what do you mean by safe kit? Safe kit means, so it is a sexual assault evidence collection or forensic examination kit. So in this kit, you need to collect the all the important evidences so that you'll get during the examination victim of rape. So it was originally discovered. It was known as Vitello Evidence Collection Kit. Then so all these are the instruments they are used so during the examination. Next comes is the examination. The examination of consent is over, history is over. Now next is the examination. First one, general physical examination. As you know, general physical examination. In that, you need to mention pulse, BP, temperature, respiratory pupils, any observation, any other observation. Examination for injuries on the body, if any. Local examination of genital parts, other orifices. Like example, external genitalia. So, genitalia, any other injuries on the external genitalia like urethral meatus, vestibule, levi majora, minora, so hymen. So hymen tear is very common in case of virgin, and the most common position of hymen tear is posterolateral. So and remember, hymen tear is one of the important evidence. So when there is a rape in a virgin girl, and hymen tear you can examine with a Gleister keen rod. The question can be asked: what are the types of hymen? What is the most common hymen? So what is the hymen that resemble like fimbriated hymen? All these are commonly asked in your exam. Then you need to examine anus and rectum, oral cavity, also the systemic examination. So all these are the components of the examination. So that is gender phase examination or examination of injuries like example bruises, abrasion, laceration, local examination, extragenitalia and others, and systemic examination. So sometimes you need to mention some defensive injuries. All these are the defensive injuries. So there can be active defense injury or passive defense injury, or sometimes there can be bruises, lacerations, abrasions over the back. So because of the road surface injuries, or sometimes there can be bruises over the lip or the oral cavity, or there can be fingertip bruising sometime. Then comes is the investigation and treatment. Investigation. What investigation? So blood for HIV, VDRL, and hepatitis, hepatitis B, urine test for pregnancy, ultrasound for pregnancy, internal injury, X-ray for injuries or fractures. So, and also we need to give the treatment at the end of the examination, like emergency contraception to prevent the pregnancy, wound treatment, like example tetanus prophylaxis, then hepatitis B vaccination, prevent the sexually transmitted disease, post-exposure prophylaxis for HIV, and the counseling and others. All these are important component of the treatment. And the eighth component, the collection and preservation of science. This is important because this is an evidence. So this can help the investigating officer to prove the crime in court of law. Like example, clothing. So the clothing need to collect physical evidence collected on white sheet. Example, loose hair or any foreign body. Then hair. So the head hair combing, the loose hair, scalp hair, pubic hair combing, or cutting or matted pubic hair. So that is useful in identification of accused by using DNA fingerprint. Then nail scrapings, so usually from the both the hands. Again, so there can be some foreign body and the nail scraping, so that can be useful in DNA analysis and identification of accused. Then swabs, the very important component swabs. Need to take the swab from the breast, mouth, in respect of the thigh, vulva, vagina, cervix, anus, and urethra for semen analysis and DNA testing. Then smears, air dried smears or slides. Look for any spermatozoa, vaginal washing, then blood grouping, and also drug intoxication. So, and also for the DNA analysis is for the blood. Then urine for any drug testing. So all these are the important samples we need to collect. We need to send it to the forensic science laboratory. The question can be asked: what are the tests for seminal stain? Example: Barberio test, Florence test. What is the confirmatory test for seminal stain? So moving spermatozoa are there. What is the time since incident? All this can be asked in your paper. Then provisional medical opinion. So you need to give provisional medical opinion once examination. This is how you should give. I have examined the survivor, name of the survivor, male or female, aged, so reporting the type of sexual violence circumstance. So reporting to the hospital or to the doctor after how many days or how many hours after the incident. And my findings are as follows. So what are the samples collected? Samples collected for hospital or laboratory, clinical findings, any additional observation is mentioned. So opinion you can give, the opinion is kept pending, awaiting for the laboratory reports. Then date and time of completion of examination, that is important, and the report contain dash number of sheets and dash number of envelopes. Then signature, name of the examining doctor, seal of the examining doctor, and the place. This is how you should give provisional medical opinion. Then final opinion. The final opinion is given after receiving lab reports. So, like this, the finding in support of the above opinion, taking into account the history, the clinical examination finding, laboratory reports of the FSL, so bearing identification mark described above, so dash hours or dash days after the incident of sexual violence, I am of the opinion that. Opinion how to give, let me explain this in detail. So, the first probable opinion is there are signs suggestive of vaginal, anal, oral intercourse with or without force. This can be the first opinion. Remember, it all depends on presence or absence of genital injury. So, if genital injuries are there, that is that shows that there is a vaginal intercourse. If physical injuries are there, definitely there will be force. And lab report positive for semen, so that is confirmatory of semen, that means that there is the intercourse. So this is the probable first opinion. Second probable opinion, There are signs suggestive of vaginal, anal, oral intercourse under the influence of drugs or the alcohol. So, in that case, under intoxication, under drug, the patient or the victim is helpless, definitely. So, there will be absence of genital and physical injury. But lab report positive for semen or alcohol or the drug. This is the second probable opinion, final opinion. Third, there are no signs of suggestive of vaginal, anal, oral intercourse, but there is a evidence of physical or genital assault. So, depending upon the presence of absence of physical genital injuries, lab report negative for semen, drug, and a lubricant. That means so there are no signs suggestive of vaginal or the anal oral intercourse, but there is a evidence of physical or genital assault. So that based on these findings. This is probable opinion 3. Opinion 4, there are no signs suggestive of vaginal, anal, oral penetration. So based on absence of physical findings, genital injuries are absent, lab report negative for semen or drug, alcohol, lubricant. This is opinion number 4. Lastly, there is a possibility of vaginal, anal, oral penetration by lubricated object. So this opinion can be given so when lab report is positive for only lubricant or absence of physical or genital injuries. So the opinion can be 5A, B, C, D, E, or any other comments you can mention you want in the certificate. So being a UG student, if you write these findings or this opinion, that is more than sufficient. Next, this is how we write the final opinion. So, final opinion after receiving lab reports, either it can be A, B, C, D, E, or F. We discussed already. Finally, you need to write signature and name of the examining doctor, seal of the examining doctor. Copy of the entire medical report must be given to survivor or be at free of cost immediately. So, and some PG students, you must know what is the guideline that is given by Ministry of Health and Family Welfare, Government of India. So you need to go through this table to give final opinion. So final opinion based on the physical injuries, FSL report or injuries or diseases, and the final opinion. So it all based on the presence of physical injuries are absent, FSL report is positive or negative. Based on that, you can give the opinion. So that is for penile penetration. Okay, and also there is a one more table for non-penile penetration. So PG student, you go through this table, try to understand what is given in the table, and there is separate opinion for non-penetrative assault also. So that's it about the question of examination of victim of rape. So if you have any doubt, you can ask me in the comment section. Thank you.